Okay, great. Yeah, I just wanted to introduce myself. I'm East Greenwich resident at Signal Ridgeway across the street, and also a pulmonary physician. I wanted to have a moment to just be able to relay concerns. As a physician and a pulmonary physician as that, my responsibility is to advocate for the health of everyone that I take care of within the community in which they live. So I am in no way in support of the burning of medical waste within Kent County or any other community in Rhode Island or the United States or internationally in the method that's being proposed. There's a dichotomy that I don't quite understand how it's being proposed. This is either new technology and unproven, or it's old technology, and that old technology, which people have mentioned is available widely as far as incineration, has inexplicably been tied to a number of different health adverse effects, specifically respiratory in regards of asthma, lung cancer, and then there's a number of other neoplastic processes, lymphoma, and basically every cancer that you can think of. There's been ties to proximity to incineration type facilities. Now, the problem is that you're not going to be able to have the data to be able to show this in a short period of time. This is things that are going to show up years down the line, and there'll be Rhode Island residents who are similar to those who have spoken already tonight, who will be diagnosed with lymphomas, bladder cancers, lung cancers, and they will not be able to directly tie their links to this. However, if we're going to say that this is somewhat similar, which I believe it is, to many other propositions that have been done before and rejected by Rhode Island, that this is just an unsafe way to get rid of I think a real problem, and that landfills we need to have an alternative. This is not the solution that I think is in the best interest of Rhode Island. There are many communities that have needed to combat incineration near their communities. There's a 20-year-old now named Destiny Watford in Baltimore who was just awarded one of the most prestigious international environmental awards that there is to be given, who advocated to stop an incinerator being constructed in her community in Baltimore. The incinerator that had been placed in one of the densely populated area in Baltimore has estimated to be responsible for nearly $55 million worth of increased healthcare costs. And my biggest concern overall is that this is not in the interest of Rhode Island residents, and the Department of the environmental protection agencies that are at stake need to be a third party. This right now seems to be, if I was compared to a medical standpoint, is like a in-lab. Theoretically, this could be done in a somewhat clean process. However, it has not had a clinical trial or a human trial. So if it's untested, it is unfit to be unleashed to this scale, to this magnitude, without serious vetting by parties that do not have vested interests in the technology, but vested interests in the safety of the community. I just date back to in the 1990s, we already passed legislation in Rhode Island, the state of Rhode Island. I'm quoting Rhode Island law that due to the myriad of over 400 toxic pollutants, including lead, mercury, dioxins, and acid gases to be emitted during solid waste incinerators, the known and unknown threats posed by solid waste incinerators and the health and safety of Rhode Islanders, particularly children, along with those of unknown threats and to the environment, are unacceptable. Despite the use of state-of-the-art landfill liner systems, leach collecting systems, landfill, particularly incinerator ash, landfills release toxic leachate into the ground and surface waters, which pose an unacceptable threat to the public and environment. The state limits ground and surface water resources. The incineration of solid waste is the most costly method of waste disposal known, and unknown escalating costs, which would place the substantial and unreasonable burdens onto the state, municipal budgets, and seriously jeopardize the public's interest. So this is already I know this is unproven, but if we are going back and saying this is somewhat similar to what has happened in other areas of the United States, it has been costly, it has been thought out, and it has been rejected multiple times. I would strongly encourage that we continue to reject this and do not make a similar mistake as other areas of the country have unfortunately done so, to not be able to block incinerators such as this. Thank you.